Good morning, everyone. Welcome to our first ever town hall, virtual town hall for It Takes a Valley campaign. I'm Dan Pennington, the president of the Vail Health Foundation, and I just want to thank all of our board members and benefactors and friends who have joined us today to hear about our COVID response, EVBH, and our behavioral health initiative, and to hear a little bit about our campaign that we have going. Your speakers today, you will hear from Will Cook, CEO of Vail Health, Chris Lindley, who's Executive Director of Eagle Valley Behavioral Health, Mary Randall, who is a member of the Vail Health Board, Chair of the Vail Health Foundation Board, and co-chair of our It Takes a Valley campaign. And then last but not least, you'll hear from Dan Godec, who is co-chair of the It Takes a Valley campaign and is also a board member of Eagle Valley Behavioral Health. So at this time, I would, also by the way, we'll have a question and answer time at the end after everyone has made their presentations and spoken. There is no chat function. There's a Q&A function at the top or bottom of your screen, depending on what device you're on. If you have a question and would like to ask it, please submit it there. But we also had a number of folks submit questions in advance. And so we will be addressing those at the end of the session. So at this time, I would turn it over to Will Cook, our president and CEO of Vail Health, to talk a little bit about our COVID response.
Well, thank you, Dan, very much for the introduction and for coordinating this. And most importantly, I want to thank the board members and benefactors who took the time to participate today, and also really position Vail Health to have had the success that we've had to date with our response. It's manifested itself in so many ways. First and foremost, I inherited an organization that was very strong financially, that had a very good strategic vision and had begun to put those into place. And it's been an honor and a privilege to help continue to execute on that strategy. And you're going to hear a little bit later just how that strategy played into our COVID response. As an example, bringing Colorado Mountain Medical into our family and setting into place Eagle Valley Behavioral Health, hiring Chris Lindley to be the executive director of that, who knew at the time that we would be relying on his doctorate in epidemiology. But it really, in my mind, none of this happens without board members and benefactors who have given us the degrees of freedom and the ability to do these things. So we are incredibly grateful, and you all should be commended for the role that you've played in this. But I know I'm speaking to most of you today also as citizens of this valley, people who love it dearly, some who live here full-time, some who might be coming back for a seasonal stay as second homeowners. And just to frame our discussion today, we don't want to spend too much time talking about what's happened in the prior phases, even though there's a lot to be learned there, the primary of which is, as long as we continue to collaborate with Eagle County Public Health, as long as we continue to keep this health system safe and capable, and as long as we continue to partner with our community, there's nothing we can't do. But these new phases are very different than the first phase. The first phase was galvanizing. Around the world, in our country, in our state, and here in the Valley, people came together. But as we try to now move from staying at home or sheltering in place to some semblance of a new world order, as we thoughtfully and carefully move towards more and more loosened public health orders, we find that we're more polarized now as a community than we've ever been. And part of that's related to, a broad degree of variability in risk profiles and people's comfort level with getting back out, or belief in wearing a mask, or concerns about second order consequences that you're going to hear a little bit more about here through this presentation. But I have to tell you, if we don't stay together and support one another and continue to do the things that got us through these first 90 days, it will be very difficult as we move forward. Additionally, it's difficult at times to tell people what they need to hear versus what they want to hear. And we're trying to take a balanced approach with this. Vail Health early on, as you know, I sent out a very alarming communication on March 17th, deliberately done to try and get people to be more consistent and adhere more with the public health orders. We did that in large part because we didn't want to end up like New York City, where the healthcare system became overwhelmed. And when that happens, case fatality rates go up. And so I want to make sure you understand that as we've moved through each of these phases, we also adjust our communication strategy. And as we think about this movement now from green to blue, which took place on May 25th, and while we're aiming to go from blue to black on June 22nd, which is the nomenclature for the varying degrees of loosening of the public health orders, they're very deliberately done in 4-week increments because it's about a 2-week incubation period for the virus. And so, part of what we want to talk about today is as we prepare to move from each of those phases, what does it mean for this valley? What does it mean for some of you who have homes in larger metropolitan areas or some other part of the country, and in fact, in some instances, world, as you're contemplating coming back here? And the number one thing I want to get across to you all is that this virus has not left the earth. It still is in the United States. It's still in the state of Colorado. It's still here in the Vail Valley. It's not going to go away anytime soon. And while we work on a vaccine and while we work on getting herd immunity, I want you to get a comfort level with the following. This hospital and health system is prepared, much more so than we were in early March, even though we started preparing in late January. For example, we have 56 inpatient beds. We have the ability now to surge to 86 inpatient beds. At the time, we only had 2 negative air pressure rooms. That's relevant because for an airborne virus, you don't want it circulating around in your HVAC system, your air conditioning, your heating. We now have 22 thanks to the hard work of our facilities folks. We initially only had 9 vents. Now we have 29 vents. We have stockpiled protective equipment. We've cross-trained staff. We're working collaboratively with other hospitals in the mountain communities as well as those back in Denver. The rest of the state is more prepared. The rest of the country is more prepared. And just to make it relative to you all, when I say that we have 86 beds and 22 negative air pressure rooms, the virus peaked in this mountain community between the middle of March and the middle of April. And at the highest point, we had 12 inpatients in our hospital with COVID. Now, we have deliberately set thresholds from an inpatient perspective and an outpatient perspective and the well-being of our staff and providers to give us plenty of additional capacity if, in fact, we start to see a resurgence. And let me restate that, when we start to see a resurgence. Because everything we've seen based on the testing that we've done, and thanks to Chris Lindley, who as an epidemiologist said to me early on, Will, we have to test broadly and rapidly. Number one, so that we can get out in front of it and trace and isolate where appropriate and try not to have the virus spread more rapidly. But number two, because we're going to need this data to understand where we stand in the cycle of the virus. We also are going to need the antibody data to understand how many people in this valley have been exposed. And while there's a lot of literature out there about testing and the genetic PCR test versus the antibody test, and can you believe what you're reading and seeing, we want to make sure that you understand that we very deliberately and very carefully chose Quest Labs, which is a national, in fact, international lab company with reputation as well as science behind the validity of their tests. And even if they're not exactly right, we still believe that the overwhelming majority of this valley has not yet been exposed to, nor contracted, nor developed antibodies for the virus. So what that means for all of us is, as we get back into this new world order, this new normal from green to blue to black, and as we welcome tourists back into this valley, and we need them, and we need our second homeowners, because without them, the economy is devastated. And without an economy, second order consequences start to eclipse the threats of the virus. As an example, in the last 2 to 3 weeks, we've had 2 people commit suicide and no one die from COVID. Does it mean that we shouldn't manage both of those things? But I want to make sure you understand, as we're trying to give a balanced message here, that as we return to a new normal, you will see an uptick in symptoms. We will see an uptick in people who test positive. We will see an uptick in people who get admitted to our hospital. And unfortunately, there might be other deaths. We will do everything in our power to prevent a death, to prevent a hospitalization. And the minute we hear about symptoms, test them right away. And the minute we determine they have positive tests, we will work with Eagle County on ways that we get folks isolated. An example of that really is what recently happened in Castle Peak, which is our local nursing home. We were made aware of a patient who had died, and one day later they discovered he tested positive for COVID. Immediately, Chris and the team worked with the locals there at Castle Peak. We deployed rapid turnaround genetic testing. We tested over 150 people, not just once, but several times. We limited the spread to 7 additional patients, 8 in total. This is not bragging. This is me trying to give you the reassurance that when you work with the county and you work with other providers, because Castle Peak isn't part of Vail Health, to have their surveillance and to test. And when you find there's positive test results there, how you jump on it immediately and stop the spread, you can save lives, and we can minimize the impact of us trying to balance managing the virus with managing the second order consequences. So our thresholds for inpatient, if we get between 8 and 12 inpatients, we'll actually work with the Department of Public Health to say, hey, maybe we need to roll back the public health orders. And even if at that point it continues to grow, with 56 beds and 22 negative air pressure rooms and 29 vents, we've got plenty of capacity on the other side of that to handle anything that has not yet manifested itself. So I want you to know that this health system, which is comprised of not just our hospital, but Colorado Mountain Medical and Eagle Valley Behavioral Health, and then our partnership with the local FQHC, Federally Qualified Healthcare Center, which is a clinic that serves the underserved, the local nursing home. We use the mirror bus to get into the mobile home units, our mobile home parks rather, to get to the vulnerable so that we keep a line of sight on it. We are all over it. From an outpatient perspective, we're seeing less than 25 patients per day, getting less than that even in urgent care. On any given day, we may have 0 to 2 inpatients in our hospital. We may have 0 to 5 come to our EDs, our urgent care, and we may have 0 to 2 results of positive. That's okay. Don't worry about it. We've got it. We're in a much different place than we were in March. And that's really the balanced message I want to convey to you all, because I actually think Eagle County, I know it is based on data, is the safest place in America to return to. Number 1, everything I've just told you. Number 2, our testing is there. Our case fatality rate is lower than just about anywhere in the country. We live in wide open spaces. And while, yes, there will be people from outside of this valley returning, I still think that we're going to be fine. I want you to be assured that even if you get symptoms or even if you test positive, we are here for you. And I'd like to actually turn this over to the next speakers so that we are mindful of time, but I want to end it where I started it, which is to say thank you to all of you as board members, benefactors, community members. The outpouring of help and support, the guidance, the direction has been amazing, and we're going to continue to need that, and we're here to help you get a comfort level with what's happening here in the Valley.
Great. Thank you, Will. And we'll take questions at the end of today's session. Next, I'd like to introduce Chris Lindley, who is Executive Director of Eagle Valley Behavioral Health. Chris?
Thanks, Dan. And to jump off where Will left off, talking about what the new emergency that's emerging, and that's the emergency caused by these second order consequences that we've actually self-imposed ourselves as we put in mitigation efforts for COVID-19. And what I want to stress to all of you guys on the phone is, just like in early January, we began pulling together, getting very aggressive on stockpiling and training and getting the systems in place to respond to COVID-19. We are doing the exact same thing today to respond to the looming behavioral health crisis that's rapidly developing. As Will mentioned, we've had more suicides over the past 6.5 weeks than we've had COVID-19 deaths. So we know we have a lot of work ahead of us. We know that the community is suffering right now. They're suffering financially. They're suffering because of the lack of connection. Us as human beings, we live to connect with other human beings. We live to connect with nature. And so those are some of the things that we are actively working on. How do we integrate that back in? How do we get the kids back connected with the kids? How do we get the parents and hanging out again with their friends so they're not with their spouse all day, every day, locked in their house? These are the things that we're all working on together. So I want to share a couple statistics with you to paint the picture of what's going on in our community. Then I'm going to tell you a bunch of resources and activities that we have going on that I hope you can share with your friends and family as well. As of today, we've seen a 30 to 40% increase in all of our behavioral health resource utilization across the Valley. That's not just at Vail Health. This includes the 5 behavioral health providers that are now fully integrated within Colorado Mountain Medical. When you go to Colorado Mountain Medical now, we have a fully integrated primary care practice where if you need behavioral health therapy while you're there, they'll come into your office and start providing therapy. Those 5 folks have been now in place since early 2020, and they're having a very significant impact. But we're now seeing that they are completely booked with folks needing their support. At the Hope Center, with a decrease in residents within this community and tourism in this community, we're still seeing a 30 to 40% increase in call volume as compared to last year. Mind centers, which actually been serving this community for now over 50 years, this is the busiest year they've ever had on history throughout our valley. Mountain Family Health Centers, our federally qualified health centers, equally the busiest they've ever had in this valley. And last but not least is our 50 to 60 private providers. Every one of them, as Dr. Casey Wolfington on our team reaches out to them, are reporting back to us. We've never had so much need. The folks that have the need is more significant than we've seen in the past. How can we better connect these folks to each other moving forward? And so the number one thing I want to share with you guys is, why are these folks suffering? What is the number one stress we hear? And this is directly from our behavioral health providers. The number one stress is financial stress. And to Will's point, which he so clearly made, is this valley cannot survive unless we bring back tourism to this valley. This valley lives and survives on people visiting, our second homeowners living here. And so the question everybody has that's coming in to see the providers, if we're not seeing a big uptick in cases right now, and the hospital is fully prepared, as Will highlighted very well, why aren't we moving a little bit quicker? And we're moving at a appropriate pace. We're working with our county partners on it. We're right there with them every step of the way. But it's hard. People want us to move quicker, right? They think the minute we open up the restaurants, the minute we open up tourism, things are going to go back to normal. And the reality is that's not going to happen. And we're seeing every day, about half of the community is pushing very hard to open up things a little bit quicker than we're moving. But we still have about half the community that is very fearful. And that fear is justified. As Will mentioned, we contributed to that fear. We worked really hard in early March to get people to take this virus very, very seriously. We wanted people to stay home. We needed to get some time in place to understand the virus, to train, to get stockpiles in place, to refigure our hospital to handle the surge that Will talked about. But the great news now is that is in place. We feel very comfortable with handling not only the patients we see today, but as Will mentioned, really a tenfold increase than what we have today. We feel confident we can handle that moving forward. So I want to talk about some of the resources we have. And thank God we have all of the partners across this valley that have been working so hard on behavioral health for the past 2 years. If you guys all remember, it was in November of 2017 that the county commissioners for Eagle County came together and decided to run a tax on the sale of marijuana and the growth of marijuana to jumpstart behavioral health in this community. And boy, has that had a big impact. And since that day, many, many partners have been working together. And I want to share just some of the big successes that have happened. But these are key resources that we want you to know about if you yourself are in need of help or your friends or family are in need of help, because the likelihood is that you know someone that needs these help right now. So the first one we want to share is the integrated behavioral health at Colorado Mountain Medical. I mentioned that before, but I want to talk to you a little bit better. We are one of the few places in the country that when you go in for a primary care visit, If your provider identifies that you need to talk to a behavioral health provider for a mental health check-in, maybe it has concerns if you have substance abuse, they will bring that behavioral health provider right there within with your primary care provider and see you right then and there. Also at Colorado Mountain Medical today, which is serves about 90% of all primary care across this valley, you can go in and just make an appointment visit and see a provider. We accept all major insurances as well as Medicaid and Medicare. They also just 2 weeks ago launched the first IOP. IOP stands for Intensive Outpatient Program. And what this is, a small group therapy, really diving in over a longer period than what you would have on an individual session with a provider into whatever issue you have. And the great news is we're doing both mental health support as well as substance abuse. This is the first time we've ever had an IOP in this community. We're also linked closely with our partners at the Johnson Depression Center through their telepsychiatry program. And we're using that partnership to the absolute max that we can. And we're continuing to expand that partnership so we can get more resources up here. Olivia's Fund. Hopefully all of you have heard about the Olivia's Fund. We've sent out some great communications about that over the past few months. This is a scholarship fund for anybody in this community, any family, any individual that is struggling to afford the behavioral health care they need. But the Olivia's Fund, which has been so generously supported by many of you, thank you, we're able to help cover 6 free sessions for anybody that needs help. I personally have seen the value of this firsthand with a young man in this community who was one of the best friends of my son. We were able to get the help and support for the family, but also all the other kids that were affected by the son's intention to end his life a few months ago. So I can't thank everybody enough and want to make sure everybody knows about the Olivia's Fund. It's available to serve anybody in our community. We also have Community Stream. Community Stream was developed by Mike Richards on our team and Dr. Casey Wolfington. In the height of this epidemic, we knew that we had to find a way to connect people to each other again. We couldn't do it in person, so how could we do it virtually? How could we share those great health and lifestyle activities, whether it's an art class, a fitness class, a virtual meeting, with our community to keep them connected? That is up and running now. If you go to communitystream.org, you can see all the different programs and offerings on there. But with that, that led to our next offering, which was a really frank conversation with our community in the launching of our first podcast. Today, we have 7 episodes that are listed. These are open, frank discussions with community leaders talking about the things that are most important in our community. If you go to those podcasts, you'll see most of them have now been viewed anywhere from 400 to 800 times, sharing great information across our community. So if you have a chance, please check out those podcasts. Within Vail Health specifically, we knew that not only do we want to work on the behavioral health for our community, but to do that, we had to first make sure we took care of our employees. And it's been a stressful time with COVID, right? You look across the country, you hear many healthcare institutions, you hear about the employees complaining about the PPE, there's layoffs across the country. Here in this valley, that is not taking place. Thank God. The county did an amazing job helping us get great supplies of PPE on hand. We ordered a bunch early. We've appropriately managed the budget. We haven't had extensive layoffs or concerns that other healthcare providers have had. But this is still a very stressful time for our providers. Many of them with kids at home that have been homeschooled or childcare problems, they're kind of battling these 2 different worlds. So with our EAP, we're proud to announce to you guys the first time we're sharing this, we've had 11% utilization amongst our staff. 11% of our staff are using our behavioral health resources. This is up from a historical norm of just 2%. So we're very excited about that. That also tells us we're doing a great job eliminating the stigma, that it's okay to talk about behavioral health. It's okay to seek support. And this is what we want to roll out across the entire community in the coming months to years. Another update I wanted to let you guys know is we talked about how do we reach out to the Spanish-speaking community. This has been a hard nut to crack for all of us, and all of us on the phone. We're very concerned about our Spanish-speaking community, but how do you do it? You do it by engaging those that grew up in this valley, that are bilingual and bicultural, that have the relationships. We now have 2 behavioral health navigators that are hired full-time that are working in this community, connecting our Spanish-speaking community to the needed resources across the Valley. We've partnered with My Future Pathways. This is the great work of Ron Davids and Brazzo and their team. We now have scholarship programs in place. So any young man or woman in our community that wants to go on and become a behavioral health provider and come back and serve this community, we have a scholarship in place, and we actually have 3 students that are getting the scholarship today at DU to become licensed social workers to come back and serve this community. But we're also going to have a loan forgiveness program that's rolling out. So those providers that are here in this community that might be suffering right now financially, for the same reasons I talked about earlier, we're going to have a loan forgiveness program that will encourage them and entice them to stay in this valley, serve in this community for many years to come. Because what we don't want to do is lose any additional behavioral health providers. And last but not least, I want to talk about just some of the technology we're using. It has been clear to all of us that technology is a way to connect folks, to share information. We all have learned that during COVID-19. I mentioned Mike on our team before. Another thing he has done is he's created a housing application, because we know it's going to be extremely important on the behavioral health side, but also on the physical health side for any of our population health management providers in this valley. We're going to have to find them housing. If you go to vailhealthhousing.com, you will see that we have a portal now in place for our employees to search over 30 properties. We've had over 200 employees access this portal and actually use it. So what we're trying to do is find every way we can to support our employees, keep them physically healthy, which we've done a great job with, as Will has mentioned. In fact, we don't have a single employee who's out sick today. We want to also keep them mentally healthy. And if they have any issues with substance abuse or any issues with stress or anxiety, we're going to get them the help they need so they can continue to serve this community into the future. Dan, that's all I have for the update.
Great, thanks, Chris. Very informative. And again, a reminder, we'll have questions at the end. At this time, I'd like to introduce Mary Randall and Dan Godec, who are co-chairs of our It Takes a Valley campaign. As I mentioned before, Mary also is the chair of the Vail Health Foundation board and serves on the Vail Health Hospital board. And Dan Godec, in addition to his role with the foundation, serves on the EVBH board. So Mary and Dan.
Thank you, Dan. First, I want to echo what Will said and thank you all for your generous support of Vail Health during COVID and for EVBH. It's been so heartwarming to see the outpouring of support that we've received over the last few months, so I thank you. I also want to give you an update on the campaign, It Takes a Valley. As many of you know, in April of 2019, the Vail Health Board committed $60 million over 10 years to support behavioral health. Half of that was to be in cash and half of that was in kind. And the in-kind services really are a range of expenses associated with staff that can help with fundraising, marketing, support, PR, and administrative support. And that commitment remains unchanged due to COVID, and it's a very solid commitment on the part of Vail Health. The foundation has partnered with EVBH to launch the campaign in December. It's a collaborative effort working with all of the key partner organizations to raise $100 million over a number of years. To date, I'm happy to tell you that we've raised approximately $20 million, thanks to the generous support of the community and many of you on the phone. But I would also tell you we are just getting started. We have a lot more to go, and we're excited about that. We've been asked whether the campaign has changed due to COVID. The goal remains the same. It has not changed. But due to the stock market and overall economic conditions, we think it's going to take us longer to raise this money. How much longer? I don't know. Wish I had that crystal ball, but I don't. The only real change that we've made is that we launched Olivia's fund earlier than we had anticipated. Chris and his team identified the need for this service to provide these scholarships for treatment, and that was moved forward. But really the commitment is even greater, as Chris pointed out and Will pointed out, about the increase in the need for behavioral health services. We're hoping that will help sponsor and generate more support financially for our effort. The campaign committee has been formed. It was maybe a little delayed due to COVID, but Dan is my co-chair, and I'm so happy to have him as a part of it. And we are very grateful to Jay Precourt, who is our honorary chair. This is a volunteer committee that's really been established to help support the campaign, both the foundation's work and the work of the EVBH board and group. And we will be supporting all of the partner organizations as well. It'll be an integrated campaign. We had our first meeting on Wednesday, and I'm happy to tell you we've got a good group of people who are energized and excited about this campaign and willing to help us. We need to reach out broadly to a big group of people to generate support for this. And if any of you are interested in learning more about it, please feel free to reach out to the foundation staff or to Dan Godec or myself, and we'd be happy to talk with you further about that. And now I'm going to turn it over to Dan Godec.
Great, thanks, Mary. Appreciate it. And Will, Chris, great updates. I think what we've learned over the last few months is that while behavioral health was an issue over the last years, it's really become an issue with COVID. We see more need, we see more cases. As Chris quoted some of the statistics, it's just getting to be a bigger issue. And so I think with the support of Vail Health initially and the generosity of the Precourt family, we got a great kickoff. And so, what can we do now? What's the role that I think we're looking for you all to play in these efforts? I think support for behavioral health is an individual decision. And just like behavioral health, I would guess that all of you have a story of somebody in your family. Maybe it's a nephew, maybe it's a close family member, maybe it's a spouse, have had behavioral health issues. We're trying to maybe not eliminate those, but certainly have resources available where you, your friends, your family members have someone to go to. And I think we've seen success. Chris mentioned some of the stories that we've seen. We want to continue that, and so we understand that it does take a valley, and that you all are very important to those efforts. I think what we're doing in the Vail Valley is at the forefront of the national effort in this regard. I think we plan to build a program that will transfer to other locations, other cities, other states. But what we're doing here, I think, just reinforces that this is a very special location. Living and having homes in the Vail Valley is special. And I think we're all very fortunate to be here. And this is one other example of ways that we can give back to our community and give back rather to those in need. So I think, how can you get involved? Olivia's fund, again, as was mentioned, provides free services for those who need it the most. Our partner organizations, Bright Futures, the Hope Center, there's several others. They're on our website. And again, if you haven't gone to the EVBH website, please visit it. It lays out, I think, the 10 different initiatives that have been developed internally that talk about, where's the money going to go? What's going to happen within the within behavioral health with the donations that we receive. So I guess I would ask you all to get involved. And is it maybe not as a donor, but certainly different ways that you can support it as conversations come up in the Valley with your friends, with second homeowners. Don't be afraid to say, have you heard what we're doing at behavioral health? It is special. It's something that I'm supporting. And you should support as well. And so I think the key is the direct involvement with all of you in helping us achieve our goals. I think, again, the resources are here, the professionals are here, the commitment's here. Let's make it happen. I think we're all, I think, on a path that we expect it to be successful. And certainly it just takes the involvement of everybody. So I appreciate, as Mary said, all the efforts to date, and we will continue to keep you updated as we move forward. And again, I turn it over to Dan again, just for questions, thoughts, and wrap it up. Thanks, Dan.
Thank you. Thanks to Mary and Dan. Thanks to Chris. Thank you, Will, for sharing information with this group that has taken time to connect with us today virtually. This is a new thing for us. We haven't done this for the foundation before, and I hope people found today's information informative. We are going to take some questions. If you have a question, there's a link at the top or bottom, depending on the device you're on, for Q&A. You can certainly put your questions into that, and we have someone monitoring those and feeding those to me in real time. But we also have asked a number of our folks who registered and are participating today to submit their questions in advance. And so we do have a number of questions already that we'll go through. Will, the first question is for you. Who makes the decision on when and how we move through these reopening stages from green to blue to black? What entity is it that makes those decisions, and how are those made?
A great question, Dan, and thank you very much. That is the responsibility of Eagle County Department of Public Health. And they have wonderful epidemiologists there, Becky Larson, so many other folks who we partner with and get guidance from. They too, of course, have to get guidance from the state. But I will tell you, Ann Smead and Mike Imhoff pulled together a group, a special task force that included people from all sectors of our community. Eagle County Department of Public Health, Heath Harmon and Jeff Schroll as an example, people from Vail Health, just about every business sector that there is, so that together we could give them guidance and work collaboratively. And again, when I spoke earlier about the thing that in my mind has been the most heavily weighted variable in our success equation thus far has been our community collaboration. You know, Ann and Mike are perfect examples of that and how they help Eagle County guide some of their decisions. So that's how that works, Dan.
Great, thank you. Chris, this question is for you. How do we help families navigate imposing structure of their children for the summer and relief for parents while monitoring the prevalence of the virus? How do we help families navigate this?
Yeah, this is a great question. And I think this is, if not the largest issue going on today, it will soon be. Unfortunately, as of right now today, our families do not know exactly what next year's school year will look like. We've had great conversations with Eagle County Schools. We've met with Phil Qualman as well as his two deputy superintendents, Melissa and Katie. We spent an hour with them earlier this week, and they are committed to trying to open up the schools, try to get the kids back in place. They're working with the county on that. I've also spoken directly with Becky Larson on this. She's working very hard to do it. There's a lot of factors involved, not only from the national level, but also at the state level. And families seeing and school districts seeing what happens on the Front Range will definitely affect us as well. What I would suggest, though, to how do you navigate this as a family is come together with other families. Reach out to your neighbors, reach out to your coworkers, find ways to do the family and friends joint supervision. Now is the time to reconnect, to work as a tribe, to come together to support each other. Unfortunately, our childcare facilities are operating still at a reduced headcount, so not everybody can get the childcare they need. But I'm certain if we work with each other and divide and conquer, maybe one dad, one mom per week watches 2 or 3 kids and they rotate so the other ones can get to work. I think that's going to be the way to do it going forward.
Great, thanks, Chris. Will, another one for you. You mentioned a little bit about the transition from one phase to another. how quickly will we know if we have a spike due to second homeowners, tourists, et cetera, coming back in this summer season?
It's a great question, and we get that question a lot. And as I mentioned earlier, it's about a 2-week incubation period for the virus. And again, the reason Eagle County, based on epidemiological data and experience, chose 4 weeks at a minimum between green to blue and blue to black was to give the virus 2 sort of cycles of opportunity to spread. And because so many people are still staying at home despite the reduced public health orders, and those who do come out are being so disciplined around wearing masks and washing their hands. And I know that's not everybody, I get it, but the overwhelming majority are behaving very differently than we did before. The virus isn't spreading as fast as it was before. It doesn't still, though, mean that we shouldn't know within 2 weeks what the impact was of, as an example, going to blue on May 25th. So on Monday, we should have a sense of what's been the uptick in symptoms and positive tests. And that's why you really want to wait 4 weeks to give it a chance to be seen. So, all in, Dan, I think that as we move to black on June 22nd, I think to get us prepared for July 4th, I want everybody on this call to know this is important not only from helping address the second order consequences that you heard Chris talk about with behavioral health and helping with the economy. It's also important to stress test our system to make sure that Eagle County has, what it needs from a tracing perspective, that we have all the testing we need, that if in fact they start showing up in our hospital, we can handle it. So we really, again, welcome second homeowners and tourists, and we'll be very careful and very proactive in monitoring it over 2 and 4 week intervals.
Thank you. There's another question here, Will, that I know we've discussed a number of times this week, even on the call that you mentioned of the group with that Ann Smead and Mike Imhoff have started through the VVF and convening that. But can you talk a little bit more about the testing, the different types of testing, who's eligible for what test? Is it free? Is it not free? How does that whole process work, please?
Yes, this has really, in my mind, been, if you go back, and I really want to look forward as opposed to looking backward, but a real missed opportunity for our country centered around testing. And, initially the testing that everybody was talking about is the genetic testing. So it's almost like forensic science. When, someone's exhibiting symptoms, you use the big swab that goes up the nose and the back of the throat to see if you can find any remnants, RNA, genetic sort of tracings of the virus being present in your body. And recall that early on, we were having to use the only test that was available to us, which was in the state. And so we would send everything back to Denver. They got overwhelmed very quickly, just like a lot of other states. It's no cut on Colorado. They've been doing a great job with us. Soon after that, when they realized that they couldn't keep up with the demand, they allowed other private labs to come in and do this. This is where Quest Labs came from that I mentioned we used, and there was a few others that were out there. We were able to actually then get our test results back a lot sooner. Now, as you flash forward 90 days through this, testing capabilities for the genetic test have enhanced significantly. And you're seeing that now in Colorado. In fact, if you look at the state data, you can see that they're down to about a 5% positivity rate. And while that's one part related to people staying at home, it's also in part related to the fact that they're testing more. Remember, a lot of this is math. And when your denominator goes up of number of people being tested, your percent of people testing positive changes. On the reverse side here in the mountain, and I'm telling you all this because I know you're wondering where can you get the data, and there's a great website that Eagle County put together, and we'll make sure we send out that link that allows you to see people calling with symptoms, number of people who've been tested, what the positivity rate is. But because this valley got hit sooner and harder than everybody else due to our skiers and our international and national visitors, we were 4 to 6 weeks ahead of everybody else. So now we're in a space where not many people have the symptoms, and therefore then we're not testing quite as much. So our denominator is shrinking a little bit. So our positivity rate may actually look higher than it really is. So bottom line is genetic testing is when you have symptoms and is it in your body, because in that moment you are contagious. There's a second form of testing, that is the antibody testing. And that testing really is when you don't have symptoms. In fact, you shouldn't even take an antibody test until at least 10 days after you have no more symptoms. And that looks for a protein that would tell us that your body has developed an antibody. And it doesn't necessarily mean that you're immune. Unfortunately, we're still learning about it. But even if you look to flu that we've all been dealing with year in and year out, where some of us get the vaccine and still get sick, or some of us, don't get the vaccine and don't get sick. So we are encouraged by someone having antibodies, whether it comes from a vaccine that we ultimately create or through herd immunity, because it at least gives us some hope for immunity against it all. But it does not give you a guarantee that you're no longer susceptible. And that's really important because a lot of our businesses and even our own organization here at Vail Health, we'd love to give everybody an antibody test. And if it comes back positive that you have antibodies, say, get on the front lines and don't worry about it at all. But unfortunately, that's not the case. So I really want to make sure, again, people understand genetic tests if you have symptoms, antibody tests if you don't. I also want to make sure you understand that we have been trying to put communication out there on our website and through social media and through the paper that access to insurance or inability to pay should not be a barrier for getting a test. What we've learned as we've moved through this is we need to evolve that as well and improve it, both in terms of communication about when you get what test and why and how do you pay for it. We're also even looking at ways that we can continue to set up little centers where people can come in more conveniently and get it without having to see a physician. So effective on Monday at Buck Creek Avon, the way we used to have the antibodies test set up out there in the Mira bus, we're going to have a similar genetic test set up because the governor made the announcement that they would be offering these for free, but that doesn't apply to Eagle County. So that created a lot of confusion. And again, thank you, Ann Smead, and thank you, Mike Imhoff, for using that task force that we do on a weekly basis to tell us, hey, how do we remove some of this confusion? And if any of you on this phone call or any of your loved ones have any questions about when you should get a test, what test you should get, where you should go, please reach out to me or Chris. We'll help you. The summarized answer is we have testing locations at all of our CMM locations. We can get you to a provider. If you don't want to see a physician, we can let you go to these special pop-up places. If someone doesn't have insurance, we won't charge them for it. We're trying to remove that as a barrier.
Thank you, Will. Appreciate that. This is a question, I'm not really sure who to direct it to, Will or Chris. It says, do you envision a date in the future, a tipping point, if you will, when the secondary impact ramifications, these things that we've been talking about as far as behavioral health, et cetera, as a result of the protective measures that we've been putting in place, take priority over COVID-19 virus itself, triggering a need to fully open our economy to avoid potentially disastrous non-COVID public health concerns?
Yeah, Will, you okay if I jump on that first? Okay. I think we're at that point right now. I think these are the discussions we're having. When we've had more suicides in the past 2 months than we've had deaths due to COVID, we have 30 to 50% of our entire residential population in this valley unemployed, 4,000 people accessing the food bank every week, which actually means 14,000 individuals, because each individual is representing 3.5 individuals. We are certainly at that point. And these are the discussions we're all trying to have. We're trying to understand, how do you balance the economic behavioral health piece with the physical health piece? But I want to just state again what Will said, I thought very clearly, but I want to say it again, is this virus is endemic. It is not going away. There is nobody in the planet in public health or epidemiology that will tell you this virus at this point is just going to up and disappear. It's going to be back this fall. We're going to see more cases this fall. We'll see cases this summer as people come and go. We have to learn to live with it. We have learned to live with so many other viruses of the past. H1N1 was a pandemic not too many years ago, 2009. Many people don't realize it. That was a pandemic, a new novel virus that swept the globe. It's still in our population today. It comes back every year. It's what we now immunize ourselves with each year for the flu. HIV/AIDS in the 80s, when that came out, we had to learn to relive with it. We had to learn to practice medicine differently. We had to learn to take care of ourselves, change lifestyle procedures to ensure we are protected. So we are at that discussion, Dan, I think today. I think everybody agrees we're at this tipping point. How do you balance it? And like I said, it's a very hard discussion because some people are still very vulnerable to COVID-19 and they're worried about their health, and rightfully so. But we also have some people that are very vulnerable to losing their home. And it's going to be very hard in this valley to shelter in place if you no longer have your home. So we have to take these things seriously, and we need to start talking about these things now openly with all partners.
Will, anything to add to that, or?
No, I think you covered it very well.
Great, thank you. Mary and Dan, this question is for you. How has the money that has been raised to date been used? Has any of it been reallocated to COVID issues or other things, even though it was targeted for behavioral health?
Well, I'll start with that. If someone makes a gift for COVID, it stays for COVID. If someone makes a gift for behavioral health, it stays with behavioral health. So there isn't a crossover per se. We try to use and are diligent about using the funds the way in which the donor or benefactor intended them to be used. Dan, maybe you want to talk about the reallocation, if there's been any reallocation of funds?
Yeah, there's been no reallocation of funds from the foundation from a donor perspective. I believe at the behavioral health board level, there have been some funds that have been allocated to certain projects that have, because of COVID, those projects have not been moved forward as quickly. Typically in the hiring of staff in some of our partner organizations, Speak Up, Reach Out, Hope Center, et cetera, is in hiring staff that kind of was put on hold through the COVID. And so those funds have been reallocated to some of the more urgent aspects of EVBH. Dan Godec, as a board member, do you have anything more to offer?
Well, I again concur with Mary and Dan's comments, and maybe turn it over to Chris a little bit, because there has been a lot done in supporting caregivers, counselors in the schools. I think within Colorado Mountain Medical, expanding the behavioral health piece to every time you go in for a physical exam, you've got a questionnaire now that's filled out with behavioral health questions. And so maybe, Chris, I know you're closer to it as executive director.
Yeah.
Let's elaborate a little bit.
Thanks, Dan. Yeah, this year, through the approval of the Eagle Valley Behavioral Health Board and the contributions that Dan covered, as well as the contributions from Vail Health, we were able to put $1.3 million out into the community across 27 different entities that are doing great work. We reached out to all those entities very early in March as we saw things developing, and we said, irrespectful of what we asked you to do, we want you to focus on this community and redirect those funds as you see appropriate to best serve this community for their behavioral health needs. So we gave all of our partners the flexibility to reposture, knowing that many of our big community events and gatherings and trainings weren't able to take place. But our partners became innovative. They found other ways to reach out, other ways to support. We've leveraged those partnerships, and they're all still focused on behavioral health, but slightly hitting different angles than what we originally visioned because we weren't able to carry out some of those activities. So I'm really grateful for all those partners and all the great work they're doing.
Great, thank you. One more question for Chris, for Will. This one's for Will. We could certainly allow Chris to chime in afterwards as well. Chris, or Will, this is kind of a two-part question. The question is, what is the biggest challenge facing Vail Health or the organization? And assuming it's the ramifications of the pandemic, are those ramifications, is it primarily a financial or an operational issue?
So for us, the biggest challenge is, what happens with the ski season next year? I mean, again, this is the challenge that all of us are faced with. We already lost the summer, and I know we're stepping back into this sort of blue, black, but it won't be a normal summer, and we don't think it will be a normal ski season. It is not out of the realm of possibility that the ski season gets canceled. We work very closely with Beth and Nadia and others from Vail Resorts to get a sense of what they're planning, but they need runway and lead time to plan, including hiring a lot of their seasonal staff. They're watching very closely what's happening in Australia right now as they prepare to open their ski season. And how do you create living quarters for people that usually are in dorm-like, settings and clean areas, and someone has symptoms but not yet tested positive, and someone who's tested positive, and just the logistics are unbelievable. And all of our partners, hotels, restaurants, they're some of the most creative people I've ever seen. But they too are trying to figure out, how do you make the finances work when you've got caps of 50% of your normal number of customers coming into your restaurant, as an example, right? So from my perspective, the biggest challenge for Vail Health is, how do we keep the economy going? Because it drives so much of everything else that we do. We're prepared from an operational perspective. We're very prepared. I'm not worried about that. I'm also not as worried about the case fatality rate, because I think we have a better line of sight. We can get to things very quickly. We have a baseline of a very healthy population. But if there's no ski season, or we attempt to do a ski season and it goes away, it's financially devastating, which then in turn removes some of the degrees of freedom that we had to do things that we've done thus far. We can withstand it if it happens. We're in a strong position, but it's not good if it happens, not just for us, but for all of our community partners and people that live in this valley. So that's the biggest challenge in my mind, Dan.
Great, thank you. Well, we're coming to the end of our time together. We allotted an hour for this, for our very first virtual town hall. So again, thank you to our presenters, Will Cook, Mary Randall, Dan Godec, and Chris Lindley. And thank you for all of you who've taken the time out of your very busy schedules to join us today and to learn a little bit more about our COVID response, what's happening with the secondary ramifications through our efforts in behavioral health initiative that is community-wide, and about our campaign, It Takes a Valley. We can't do this. When we chose the terminology It Takes a Valley as the moniker for this campaign, it was by design. None of us can do this on our own, without the county, without all of our partner organizations, without the hospital, without our volunteers, and of course our benefactors. So thank you all very much for joining us today. We have recorded today's session, and we will send it out to all of the folks who were on the invitation list. Likely will get posted to one of our websites in the future as well. And we'll also send out a survey. We want to know how this worked for you, whether you'd be interested in having more of these as we go from green to blue to black and try to get back to normal when we can do these face-to-face. But we would love to have your feedback in that survey. So again, thank you everyone, and enjoy the rest of your afternoon and weekend. Thank you.